It's a diagnosis that can be very scary. However, a new treatment option for metastatic breast cancer may be on the horizon. Dr. Denise Yardley and Shirley Mertz have the details.
So, metastatic breast cancer is a form of the disease that is the most serious. It's advanced, that has a treatable component, but it's not curable. And so, patients facing this diagnosis, of course, immediately want to know about treatment options and what they offer. And I think when we look at that, we look at overall survival, a meaningful endpoint in making a recommendation for a drug or treatment of how long that may prolong that patient's survival. And so with a drug like Kisqali that's reported the longest median overall survival for the hormone receptor positive metastatic breast cancer patients, these patients can expect to have a survival on average of over 5 years. And so there's lots of excitement and enthusiasm when we look at extending a patient's life, partnering it with an excellent quality of life, since Kisqali is an oral medication patients can take in the convenience of the home. And also with this prolongation gives us more time to look at developments of other exciting agents that may continue to improve that patient's overall survival and outcome. And so for metastatic breast cancer, while treatable but not curable, when we look at drugs like Kisqali that offer this increase in overall survival, we really embrace that as a treatment opportunity for patients.
Because metastatic breast cancer has gone outside the breast to either bones, the lung, liver, even the brain, the metastatic breast cancer community hopes that there will be treatments for us when we experience progressions or advancement of the cancer in whatever area we have the disease. Unfortunately, cancer cells are really smart and they're relentless. And even though a treatment may be working for us, there comes a time when it stops working. So we have to hope that when we go back to our doctor and we receive that awful news that our cancer is advanced, we hope that there will be another treatment that will help us live longer. And that's really what the advancement or discovery of a drug like Kisqali means to us. It means that for those who have hormone-positive disease, they can live longer. And living with metastatic breast cancer, as I have done for a long time, is like being on a roller coaster. There are times when your treatment may be working and you can try to live as normally as you can, but then as Dr. Yardley mentioned, you have to go back in and get checked. And if you find out that your disease has started again, then it's like that roller coaster. Now you're going down, and you have to hope that there is another treatment that will keep you going. But truly, a quality of life is measured by connecting with other people, having hope for the future, hope that you will live longer. And with that, I think that's how the metastatic breast cancer community survives, relying on each other for that hope and new treatments.
And as always, we do ask patients to check with their healthcare providers to find out if drugs like Kisqali or other treatments are appropriate for their disease. And if they're interested in getting more information, they can look at Kisqali.com, which is KISQALI.